But this is the fun stuff. This is applying this stuff. And it's about congestive heart failure.
So that would give you a headache?
What's that?
That would give you a headache?
What gives you a headache?
Blood pressure or high.
That could be one of the many reasons. I mean, meningitis could cause it, but if you're talking about blood pressure, if the blood pressure is high here, yeah, it could go. But the problem is you want to check this fast and cure it, because the blood pressure can be so high that it'll make the blood vessels in your brain burst and cause a stroke. So, yeah, but we'll get into blood pressure next week when we talk about circulation. All right, so clinical applications. Congestive heart failure. Raise your hand if you heard of congestive heart failure. Yeah, okay, all of you. So what is it all about? Well, it's basically that the heart is not pumping effectively or efficiently. And there's a lot of reasons why this would happen. It could be that there's coronary atherosclerosis. Basically what's happening is those coronary arteries are getting plugged up because of the wonderful cholesterol that you're eating. And that's less blood flow going to your heart muscle, and that means the heart muscle is not working efficiently. It could be persistent high blood pressure that can cause this. Multiple heart attacks can do this, 2, 3 heart attacks. That means parts of the heart are just dead, and now it can't squeeze efficiently. Or you can have some sort of congenital heart defect, dilated cardiomyopathy. But there's a lot of other reasons. I'm just giving you a few on there, the more common ones. Now, congestive heart failure, there's 2 types, and you can handle this. Basically, there's left congestive heart failure, and there's right congestive heart failure. And you can figure this all out, and you can figure out all the symptoms and signs if you know this. And I'll show you, okay? Very easy to manage. Again, put your pencils down. I'll show you the 2 pictures. It'll make total sense to you, okay? This is left-sided congestive heart failure, and it makes total sense. Watch this. For some reason, the left heart is not pumping effectively or efficiently. Heart attacks, high blood pressure, whichever. It's not working efficiently. It's not pumping blood. Only 40% is coming out of the heart. So look what's going to happen here. If only 40% go out into the aorta, would you expect the blood pressure to go down or up? If there's less blood going into the bloodstream. Down. Okay? Now, that low blood pressure is going to go into all different areas. And one of those areas is going to be the kidney. Now, the kidney is going to sense low blood pressure. And it's not a good thing. We've got to have the homeostasis going on. So what the kidney's going to do is that it's going to release a hormone called renin. Renin is going to increase aldosterone, and it's going to increase blood pressure. Okay? But the heart is still not working effectively. So as soon as the kidney's going to increase the blood pressure, it'll go right back down. So what the kidney says is, fine, you're going to make it go up and down, up and down. What I'm going to do, the kidney's saying this, and your body has these conversations. What the kidney's going to say is, fine, it's that low, we don't know why, I'm going to make a lot of renin come out. It's going to overshoot. It's going to put more renin out there so that we can actually keep the blood pressure up. But it keeps on going down. So the renin comes out so much that you get high blood pressure. Does that make sense? Because it's always going down, the blood pressure's got to always be up, but it overshoots. So with people with left congestive heart failure, they are going to have high blood pressure. Immediately you'll see low blood pressure, but you won't see it because it happens so quickly and your kidneys affect it so quickly. So you don't see, but that's the reason why you get the high blood pressure is because of the initiative low blood pressure, but you don't see it. So people with left congestive heart failure have high blood pressure because the renin's getting poured out. Their cardiac output is going to be very low. You see? Now, let's work backwards. That's what's happening here. cardiac output goes low, the kidneys will sense that. Kidney's going to release renin. Blood pressure goes up, you get high blood pressure. Now, going backwards. Since the left heart can't pump the blood forward, now the left ventricle is going to fill up with blood. It's going to get congested with blood. You all agree? Which means that blood from the left atrium can't go into the left ventricle so effectively. Do you agree? If the left atrium starts filling with blood, going backwards, what's the next organ that's going to be backup of blood? Lungs. So what's going to happen here is that they're going to have pulmonary congestion. They're going to have pulmonary high blood pressure, hypertension. There's going to be so much blood in the lungs that these people will cough up blood. Does that make sense? You got to go backwards. If you don't understand this, forget about doing that. You understand how this is so vital for you to know? The bonus is going to be good for you guys. All right? Any questions with left-sided heart failure? That's not bad. It's putting it all together. Let's look at the other side. Right-sided heart failure. Looks similar but different. Now, for some reason, the right heart is just not pumping efficiently. Which means, are we going to have a decrease of blood going to the lungs or an increase of blood to the lungs? Decrease. Does that mean there's going to be a decrease of blood going to the left atrium? What about decrease of blood to the left ventricle? What happens to cardiac output? Decrease. So what happens to blood pressure? Decrease. You see? That low blood pressure is then going to reach the kidney. The kidney's going to sense low blood pressure. It's going to release the renin. Now you get the high blood pressure. So in both left congestive heart failure and right congestive heart failure, you're going to have high blood pressure for that reason. Are you going to cough up blood in right-sided heart failure? No. The blood isn't backing up. It can't get to the lungs. So here someone tells you congestive heart failure, your lungs are not congested, but yet you've got high blood pressure. You already know that you've got right-sided heart failure. Does that make sense? Don't memorize it. Understand the concept. Now, let's go backwards. If the right heart can't pump forward, then the right ventricle is going to fill up with blood. What happens to the volume of blood in the right atrium? High. It increases. So, what are the two major blood vessels that go to the right atrium? Superior and inferior vena cava. Now, through gravity, your inferior vena cava is going to get affected first, right? Because gravity's there, so you're going to get a backup of blood happening to your inferior vena cava first. That makes sense? We're in the lower areas. So what happens here is that blood is going to pool down into your veins of your legs. And because the blood is so high there, the plasma, all right, the water from the blood is going to seep out from the bloodstream and go into the interstitial area, your skin. And what's going to happen to your feet? They're going to swell up, a condition we call edema. Does that make sense? It's going to swell up, and gradually it'll start from your toes, to your feet, to your ankle, to your shin, to your knee. And when medical professionals say that there's edema to the feet, we usually grade it like +1, +2 and stuff. Basically, how high it is. You don't have to worry about the +1 and +2. But it's gradual. That's why we're concerned. You got edema up to the knees. That's pretty damn high. You see what I'm saying? That'll eventually go into your abdomen. And it'll cause edema in your abdomen, a condition we call ascites. And they start having fluid in the abdomen. Gradually, as it goes up, it'll go to the superior vena cava. That's where we're really concerned. Because the superior vena cava get a backup of blood, comes from the brain also. So now you've got edema of the brain. Not good. Put you in a coma. And that's what happens here. All right? Does this make sense? Can you, again, it's about this. And this isn't hard. You want to memorize it, go right ahead. But I guarantee if you understand it, it'll save you time on studying for your future. Because this is what we have a lot of people having is congestive heart failure. Okay? That's what edema looks like. If you haven't seen it before, you press down on the toes over here on the feet, depending on how severe it is. You press down on it. When you let go, your fingerprints are still there. It takes some time for the fluid to go back into the interstitial area. It's kind of like, I would say, like wrestling mats. If your son or child was ever in the wrestling, those mats, you press down on, you let go, it takes some time for it to fill up again, right? That's basically what happens over there. You got to press it against a bony structure like your tarsals or something. But it does that. That's edema. You don't want that in the brain. So these are signs that we could fix up. Yes, you get that too. But that's the reason why you're getting it. Usually when a woman's pregnant, they're young and they don't have congestive heart failure. It's just there's a lot more fluids in the body that the body is not used to, so the heart has to pump faster. You got more fluids, you got more baby there, so there's more fluids. So usually your body will compensate. There's some edema that happens in the feet, and we wouldn't give them any kind of diuretic or anything. We know the reason for it, and in 9 months it will go away. So we could, we give them reassurance. Wear more slippers or something like that. But if there's pain there, then we'll do something. But usually they can live with it. It's fine. They're usually young. It's not because of the heart. Although, yes, you get those odd situations where a woman has, let's say, a heart attack at 23 years old for whichever reason. You have congenital heart failure or something like that, and that could be the reason. But usually, when a woman has edema in the feet, it's usually due just because there's more tissue, more placenta. There's a placenta there, there's a baby there. So your body compensates by putting more fluid in the body, but it goes to the baby. But there's extras that still need to go elsewhere. That's what happens. Questions on that? All right, and just effects on aging, sclerosis. As you get older, your arteries, we'll talk about this later, but your arteries get harder. Okay, the thickening of the valve flaps just occur as you get older. Kind of like you put a nice Porsche car and you let it sit in the field for 10 years. It'll stay there and be wonderful, but the tires themselves have a lifespan and they start rotting away, right? So you could be really healthy, that's fine. You could be, all these, doing curves or whatever. You're doing all these, but you can't really change the lifespan of your arteries. They will just get hard. That's why you can't help it, but you will always get high blood pressure. As you get older, it's just because your arteries get harder. You can't do anything about that. So when you're 65, 70, you'll probably be on some sort of blood pressure medication. Doesn't mean you're not healthy. You're just trying to compensate for what your body is doing in aging. Okay, and that's what happens. Okay. Questions?